So we're talking about the word normal. What does normal mean anyway? How do I know that this is normal and this is not? How do I know that this is normal and this is not? How do we figure that out? A lot of times when we talk about the word normal, we're actually saying most common. Because we can say, it's normal for humans to have two hands. But the reason we say that is because 99.9% of humans have two hands. I started to realize that I was going to have to figure out, how do I prove that something that's actually extremely rare is still considered normal? Because having a quote-unquote normal spine in this day and age is actually extremely rare. Being a chiropractor, I've seen countless x-rays, and I can count on one hand how many normal spines I've seen. But why is it still considered normal if it's so rare? When you look at anatomy, the word normal has nothing to do with the word common. The word normal in anatomy, and especially when you're looking at the spine, has to do with function. So, what is the function of the spine? I'm going to go over 3 of the main functions of the spine, and I'm going to talk about how those 3 functions are going to give us a clue into what exactly a spine is supposed to look like. So there's a really common saying out there that structure dictates function. And it makes a lot of sense. You can look at your teeth. The structure of your molar is designed to grind. The structure of your canines are designed to rip and to tear. You can look elsewhere. You can look at a spoon. The structure of a spoon is obviously supposed to hold liquid. So if we're trying to figure out function, we can follow that equation. Structure dictates function. If we know the structure, we can figure out the function. But what if we know the function and we're trying to figure out the structure? Can we work backwards? I think we can. Your spine is designed to do 3 main things. Number 1, protect your nervous system. Number 2, permit motion. And number 3, provide nourishment to your brain. I'm going to dive deeper into these 3 topics so we can understand exactly what the function of the spine is and what that tells us about what the structure of the spine is supposed to look like. Function number 1 of the spine, protect the nervous system. So what does that mean? The nervous system actually starts right here at your brain and extends down your spinal cord all the way down here and exits out the side. And these nerves go to every single cell, tissue, and organ in the entire body. So if the spine is meant to protect the nervous system, then wouldn't you agree that if the spine was twisted and bent and putting all sorts of pressure on these little yellow nerves coming out on the side, that it would be failing at the job of protecting your nervous system? So if your spine in this position is failing at that first job requirement of protecting your nervous system, what does it have to do in order to succeed? Let's take a look a little closer. The spine is made up of 24 movable segments that we call vertebrae. And these vertebrae are joined together by joints. They're designed to fit together in a particular way. If we take a look at it from the side, these joints in the back are called facet joints. These joints were designed to fit perfectly one on top of another like a bunch of Lego pieces. And these joints are all the way down the spine. If we look at it from the front, we see a bunch of discs that separate each one of these vertebrae. These vertebrae sit on top of these discs like a ball bearing. Ideally, the center of that disc should be sitting right underneath the center of the bone. It's designed to fit that way. So if we go back to our twisted spine, we can see that when the facet joints don't line up, that hole is also not going to be situated right. And now that the protection is gone, the nerve is exposed, irritated, and inflamed. So we work backwards with what we know. The facet joints are supposed to align one on top of another. Now that hole is a lot nicer. We go back to the front. This bone is supposed to sit perfectly on top of this bone where it sits right on top of the middle of the disc. If we do that, now the hole is wider and healthy, and this nerve no longer has a bunch of pressure and inflammation put on it. So now we know that if the joints of the spine are aligned, then the protection of the nervous system is sustained. So question number 1 was, what does the spine have to look like in order to properly protect the nervous system? Well, The spine needs to be in proper alignment with the joints in order for that nerve to come out in either side of the spine and communicate with every cell, tissue, and organ in the body. Because we know that when it's twisted and bent, that hole starts to get contorted and smaller, and that nerve gets pressure put upon it. And when there's nerve pressure, there's nerve irritation, and nerve irritation leads to a decrease in function to wherever that nerve is going to go. So question number 2, what does your spine have to look like in order for it to permit you to move, bend, and twist like you're supposed to? To answer that question, we need to go back to the spine and understand what these joints are actually supposed to do. So the joints in the back here, the facet joints, are designed to guide motion. So in the top, they're angled like this and slightly bent forward, allowing us to bend sideways and rotate at the same time. And we can twist and turn, and it'll be all within the normal range of motion of the neck. The joints of the spine are angled in a certain direction, which allows our spine to bend and twist along that exact angle. The angle in your cervical spine is different than the angle in your low back. If we look at the angle of the facet joint here in the low back, they're almost straight up and down. This is allowing for good motion when we're bending forward and when we're bending back, but not so great when we're moving left and right. There's not a lot of rotation that's permitted in that low back because that's the proper angle of the facet joint. So the joints in the back of the spine are telling us how exactly we can move, but the joints in the front of the spine, these disc joints, are telling us how much we can move. But once we start getting degeneration, we start seeing those thinning discs, it actually lessens the amount of motion because it decreases the magnitude by which we can move. The guiding or the direction stays the same because that's dictated by the facet joints, but the amount we can move is dictated by the disc. So these joints in this twisted and mangled spine aren't going to allow for a lot of good motion. And we understand that because the joints aren't aligned. So let's see. Question number 2, how do you permit for better motion? You go back to the same answer as question number 1. You align the facet joints and the disc. When these bones are back in their proper alignment, in the back and in the front, we can see that now the guiding motion that's dictated by the joints in the back are all healthy, and the amount of motion, which is dictated by the joints in the front, are nice and healthy as well. When the facet joints are aligned, it allows for the proper guided motion, left, right, forward, back, rotating left and right. But when they're not properly aligned, it gets stuck, and it's not allowed to move as freely as it should. And you can try this at home. Ideally, you should be able to turn your head all the way to the right and equally as far to the left. There should be no pain. You'd be surprised, a lot of people can't do that. Also, you should be able to look all the way up and all the way down, and there should be no pain with that either. And you shouldn't feel any restrictions there. If the joints aren't properly aligned, you're going to see that it's not allowing for proper motion to be permitted. So question number 1, how does your spine have to look in order for you to protect your nervous system? Your joints, both in the back and the front, need to be aligned exactly how they were designed to be aligned. Question number 2, what does your spine have to look like in order for it to permit proper motion? Your joints, both in the back and in the front, need to be aligned exactly how they were designed to be aligned. Question number 3, what does your spine have to look like in order for it to provide proper nourishment to your brain? So the spine is designed to protect your nervous system. It's also designed to permit motion. And lastly, it provides nourishment to our brains. Dr. Roger Sperry in 1981 was a Nobel Prize winner in brain research. He said this: 90% of the stimulation and nourishment to the brain is generated by the movement of your spine. That's amazing. So if we know that that's the function of the spine, how does that help us figure out the structure of the spine? When the joints of the spine, both in the back and in the front, are aligned exactly how they were designed to, it's going to protect your nervous system, it's going to permit for that proper motion, and when that motion is properly permitted, it's going to flood your brain with stimulation and nourishment that it needs. 90% of the stimulation and nourishment that your brain receives is generated by the movement of your spine. And when you look at your spine and you align all 200 plus joints of the spine together, you're going to get something that looks like this. When you're looking at the spine straight on, it should be perfectly straight up and down. But when you look at it from the side, you're going to see these reciprocating curves. In the low back, we have this curve that goes forward. In the mid back, we have this curve that points back. And in the neck, that curve points forward again. That's what it's going to look like when all the joints are aligned. So we just went over 3 of the main functions of the spine. Number 1, to protect your nervous system. Number 2, to permit motion. And number 3, to provide nourishment to your brain. Given that function, we can now figure out the structure. Because the answer to all 3 of these questions, what does your spine have to look like in order to accomplish these 3 goals, was the same. The joints in the back and the joints in the front need to be properly aligned as they were designed to in order to accomplish the 3 functions. So just as structure dictates function, function dictates structure. Now I know a lot of you probably figured out that the answer to the question was pretty obvious. That we know that our spines are supposed to have these reciprocating curves to the side and it's supposed to be straight up and down to the front. But I didn't want to assume that. The reason why it's important to logically prove that is because when we're analyzing a spine, we need a gold standard to compare to. So the overarching question was, how do I know what a normal spine is supposed to look like? You know that the function of the spine is going to dictate the structure. The function of the spine is these 3 things: protect the nervous system, permit motion, and provide nourishment to the brain. In order for that to be accomplished, the spine needs to be in proper alignment both in the back and the front. All the joints need to be moving and responding to each other as they were designed to. Don't forget to like, subscribe, yada yada yada. Catch you guys next time. That's amazing.